Hey there, welcome back. Today we're taking a deep dive into the world of eye surgery.
Oh, buckle up. It's a fascinating field.
Yeah, it really is. And this one is especially for you, listener. You sent us some really cool stuff on different types of eye surgery,
Lots of different options out there these days.
for sure. So we're going to break it all down, help you make sense of it all.
Become an eye surgery expert. Well, almost.
Exactly. We're going way beyond ASIC, the typical stuff everyone knows.
Oh, yeah, we're going to get into some cutting edge advancements, maybe even some procedures you've never heard of before.
Absolutely. Get ready for some surprises. It's going to be fun and informative, I promise.
It's amazing how much this field has changed, even in the last few decades.
Oh, totally. I mean, think about it. Not that long ago, radial keratotomy was the big thing, right?
Yeah, but now we have these incredible lasers, super precise, and advanced lens implants, much safer and way more effective.
It's like night and day. Okay, so the material you sent us starts with the basics, corrective eye surgeries.
The kind that help you ditch those glasses or contacts for good.
Exactly. But before we get into the specific types, let's make sure we're all on the same page.
Yeah, good idea.
Can you give us a quick refresher on what refractive errors are and why they make things look blurry?
Sure. Refractive errors are basically imperfections in the way your eye focuses light.
Like a camera lens that's out of focus.
Exactly. And there are three main types:
Mm.
myopia, hyperopia, and astigmatism.
Okay, let's break those down one by one.
All right, so myopia, that's nearsightedness. You can see things up close just fine, but distant objects are blurry.
Ah, I know that one well.
Yeah, it happens when the light focuses in front of the retina instead of directly on it.
So the image is landing short of where it needs to be.
Exactly. Now, hyperopia, that's farsightedness. You can see far away clearly, but things up close are blurry because the light focuses behind the retina.
Okay, so it's the opposite of myopia.
Right. And then we have astigmatism, which is where the cornea, the front part of the eye, has an irregular shape.
Instead of being perfectly round.
Yeah, instead of being round like a basketball, it's more oval-shaped, like a football. And that scatters the light, making everything look blurry, both near and far.
Gotcha. And the material you sent highlighted some interesting stats from the American Refractive Surgery Council.
Oh yeah, some impressive numbers.
It said that over 843,000 laser vision correction procedures were done in just 1 year.
Wow, that's a lot of people saying goodbye to their glasses.
Right. Okay, so let's jump into those different types of corrective eye surgeries.
Let's do it.
First up, the most well-known, LASIK.
Ah, LASIK, laser-assisted in situ keratomy lucis, to be precise.
Quite a mouthful. But yeah, everyone's heard of LASIK. Could you break down how it works?
So basically, LASIK uses a laser to reshape your cornea to correct the refractive error.
Sounds pretty straightforward.
It is, relatively speaking. The surgeon creates a thin flap in your cornea, lifts it up, and then uses a laser to remove tiny bits of corneal tissue. This changes how the light focuses in your eye. Then the flap is carefully put back in place, and it heals naturally.
It sounds almost too simple. Is that why it's so popular?
Well, partly, yes. It has a very high success rate.
Oh, that's good to know.
And the recovery time is relatively quick. Most people see a huge improvement in their vision within a day or two.
Wow, that's impressive.
And they can usually go back to their normal activities pretty quickly too, but it's not the perfect solution for everyone.
Right, and that's where PRK comes in.
Yeah, PRK or photorefractive keratectomy is a great alternative for people with certain needs, especially those with thin corneas, high prescriptions, or people who are in professions where a corneal flap could be a risk, like athletes or people in the military.
That makes sense. So how is PRK different from LASIK?
Well, instead of making a flap, PRK involves removing the very top layer of the cornea called the epithelium.
Okay, so no flap.
Nope. The laser then reshapes the cornea, and a protective contact lens is placed on the eye while the epithelium grows back.
So I'm guessing the recovery takes a bit longer with PRK.
It does, yeah. And there can be a bit more discomfort in the first few days after the procedure.
But in the long run, are the results comparable to LASIK?
They are, yes. Both procedures can achieve excellent vision correction.
That's good to hear. Now, the material also mentions LASIK and epiLASIK.
Oh, yeah, those are like modified versions of LASIK and PRK, trying to combine the best of both worlds.
How so?
With LASIK, they create a thinner flap using an alcohol solution, while epiLASIK uses a special instrument to create the flap.
So the idea is to minimize any potential flap complications.
Exactly. And these techniques can also be good for people with thinner corneas.
More options, that's always good.
Yeah.
Okay, now this one sounds really futuristic. Smile.
Yeah, small incision lenticule extraction.
Catchy. And they call it flapless, right?
Yes, because it doesn't involve creating a corneal flap like LASIK or LASIK. They use a femtosecond laser to create a tiny lens-shaped piece of corneal tissue called a lenticule inside the cornea.
Inside the cornea.
Yep. Then they remove that lenticule through a small incision, which reshapes the cornea and corrects the vision.
So less invasive, potentially quicker recovery.
That's the idea. SMILE is often associated with faster visual recovery and less dry eye afterwards compared to LASIK.
Sounds promising.
Some studies even suggest it might be more stable in the long term, but it is still relatively new.
Right, still gathering data.
Exactly. So that's why some surgeons are still a bit cautious about recommending it over LASIK, especially here in the US, where it's currently only approved for treating myopia.
Interesting. It seems like choosing the right procedure really depends on the individual's needs and what their doctor recommends.
Absolutely. It's a personalized decision.
Now, the material you sent also briefly mentioned some older procedures like radial keratotomy, astigmatic keratotomy, and limbal relaxing incisions.
Ah, yes, the pioneers.
But it seems like laser technology has pretty much taken over now.
It has, and for good reason. Those older techniques were groundbreaking in their time, don't get me wrong, but they've mostly been replaced by laser surgery and lens implants.
Why is that?
Well, think about radial keratotomy, or RK, for example. They used to make these incisions in a spoke-like pattern on the cornea to flatten it.
I can't even imagine.
It was effective for some, but it had a higher risk of complications.
Yeah.
And the outcomes were less predictable compared to what we can achieve now with modern methods.
So it's safe to say technology has revolutionized this field.
Oh, absolutely. The precision and predictability of lasers have dramatically improved the outcomes and safety for patients.
That's fantastic. Okay, moving on from laser procedures, the material talks about refractive lens exchange, or RLE, and prelex. These sound a bit different.
They are. Unlike laser surgeries that reshape the cornea, RLE and prelex involve replacing your natural lens with an artificial one, an intraocular lens, or IOL.
So instead of reshaping, you're replacing the lens.
Exactly. It's like having a permanent contact lens implanted inside your eye.
Whoa, that's wild.
RLE is often a good option for people who aren't good candidates for LASIK or PRK.
You mean people with thin corneas or high prescriptions?
Yeah, among other things. But it's also gaining popularity as a way to address presbyopia.
Presbyopia. That's the age-related farsightedness, the one that makes it hard to read up close.
That's the one. And one of the cool things about RLE is that it can actually prevent cataracts later in life.
Wait, so you're getting rid of your natural lens before it even has a chance to develop cataracts?
Exactly. Two birds, one stone.
That's amazing. Now, what about prelex? How is that different?
So pre-ELEX is a specific type of RLE that focuses specifically on correcting presbyopia. They use a special type of IOL called a multifocal or accommodating IOL.
What's so special about those?
They allow you to see clearly at different distances, which can reduce or even eliminate the need for reading glasses.
So it's really targeted towards people who are struggling with their close-up vision as they get older.
Exactly. It's becoming a very popular alternative to reading glasses or bifocals.
I can see why. Okay, now we also have phakic intraocular lens implants, or phakic IOLs. Where do those fit in?
Phakic IOLs are interesting because unlike RLE, where they remove your natural lens, these are implanted in front of or behind your natural lens.
So they work together to correct vision.
Yes. This procedure is usually reserved for people with really high myopia who aren't suitable for laser surgery.
Makes sense. And I read that one of the main benefits of phakic IOLs is that they're reversible.
That's right. If for any reason you need to, the phakic IOL can be removed, which makes it more flexible than RLE, where the natural lens is gone forever.
That's a good point. It's amazing how many options there are now.
It really is. There's a solution out there for almost every vision problem these days.
It's true. All thanks to these advancements in technology and surgical techniques.
It's remarkable how far we've come.
Absolutely. But wait, there's more. The material also delves into keratoplasty procedures.
Oh yes, keratoplasty. Basically, any surgery involving the cornea.
And we've already discussed some, right? Like LASIK, PRK, LASIK. Those are all laser-based keratoplasty.
Exactly. But there are other types of keratoplasty procedures that target specific corneal issues.
Like what?
Well, one example is conductive keratoplasty, or CK.
And what does that involve?
CK is actually a non-invasive procedure that uses radiofrequency energy to reshape the cornea. It's often used for mild hyperopia or presbyopia, and it can even be done after LASIK or cataract surgery to fine-tune vision.
So it's like a little bonus round of correction if needed.
Exactly. Then there's laser thermal keratoplasty, or LTK, which is similar to CK but uses a laser instead of radiofrequency energy.
Okay, so both are aimed at reshaping the cornea.
Right. And LCK is a non-contact procedure, which means a laser doesn't actually touch the cornea directly.
Interesting. And lastly, the material mentioned automated lamellar keratoplasty, or ALK. What's special about that one?
Well, ALK used to be more common for correcting higher degrees of myopia, but it's less frequent now because we have safer and more predictable options. It involved creating a corneal flap like LASIK, but instead of a laser, they removed a small disc of corneal tissue to reshape the cornea.
Sounds like a precursor to the more refined laser techniques we have today.
It was. You could say that ALK paved the way for a lot of the advancements we see in keratoplasty now.
That's fascinating. So we've covered a whole bunch of corrective eye surgeries, from lasers to lens implants to keratoplasty.
Yeah.
It's really remarkable how far we've come in addressing vision problems.
It's true. But remember, corrective surgeries are only one part of the story. There's a whole world of eye surgeries out there aimed at treating various eye diseases and conditions.
Oh, you're absolutely right. Hold that thought, because that's where we're heading next. Get ready to dive into the world of common eye surgeries that go beyond vision correction.
All right, so let's dive into those other types of eye surgeries you mentioned, the ones that go beyond just correcting vision. We're talking about surgeries that treat specific eye conditions. The material you sent starts with diabetic retinopathy surgery. Sounds pretty serious, right?
It does. I know diabetic retinopathy can be a real concern for people with diabetes. Can you explain what it is exactly and why it's so serious?
Sure. So diabetic retinopathy is a complication of diabetes that affects the blood vessels in the retina. You know, the retina is that light-sensitive tissue at the back of your eye that's crucial for vision.
Yeah, the retina is like the film in a camera capturing the images.
Exactly. And over time, high blood sugar levels, if not well managed, can damage those tiny blood vessels in the retina, causing them to leak fluid or even bleed.
Oh, that doesn't sound good.
No, it's not. And that leakage or bleeding can interfere with your vision, leading to blurry vision, blind spots, and in severe cases, even complete vision loss.
Yikes. So I'm guessing that's where surgery comes in to try to stop or reverse that damage.
Exactly. Surgery isn't always the first line of treatment, of course. Doctors will try other things first, like managing blood sugar levels and medications.
Makes sense.
But if the retinopathy progresses and starts threatening your vision, then surgery becomes really important.
So what are some of the surgical options for diabetic retinopathy?
Well, it depends on the severity and the specific type of retinopathy you have, but one common approach is laser treatment.
Oh, lasers again. Seem to be a big part of eye surgery these days.
They are, and for good reason. Lasers are incredibly precise. In the case of diabetic retinopathy, they use a very focused beam of light to actually seal off those leaking blood vessels.
So it's almost like they're using the laser as a tiny welding torch to repair those leaky spots.
That's a great analogy. And in some cases, the laser can also be used to destroy abnormal blood vessels that are growing on the retina.
Wow, that's amazing. So using lasers is a pretty effective way to slow down or even stop that retinopathy from getting worse.
Yes, it often is. Another common treatment is anti-VEGF injections. VEGF stands for vascular endothelial growth factor.
Say that 3 times fast.
Right. But what it is a protein that promotes the growth of new blood vessels. And that sounds good in theory, but in diabetic retinopathy, too much VEGF can actually lead to the formation of more of those abnormal leaky blood vessels.
So more is not always better in this case?
Not at all. That's where anti-VEGF injections come in. They block that growth factor, helping to prevent the formation of those unwanted blood vessels.
I see. So those injections are going straight into the eye.
They are. And it's amazing how effective they can be. They work by reducing the leakage and swelling in the retina, and they've become a standard treatment for not only diabetic retinopathy, but also wet AMD, which we'll talk about a bit later.
Interesting. The material also mentions steroid injections as a treatment option. Do those work in a similar way?
Steroid injections are a bit different. They're mainly used to reduce inflammation and swelling in the retina, particularly in cases of something called macular edema.
Macular edema.
Yeah, it's a buildup of fluid in the macula, which is the central part of the retina responsible for that sharp, detailed vision we need for things like reading and recognizing faces.
Oh, so that's why it's so important to keep that macula healthy.
Absolutely. So steroids can be really helpful in reducing that swelling and preserving vision.
It seems like there are quite a few tools in the toolbox when it comes to treating diabetic retinopathy.
There are. And the key takeaway here is that early detection and timely intervention are absolutely essential to prevent vision loss from this condition. So if you have diabetes, Regular eye exams are a must.
Good advice. Now let's talk about cataracts. The material you sent mentions laser cataract surgery. Can you explain what cataracts are and how laser technology fits into that picture?
Sure. So a cataract is basically a clouding of the natural lens in your eye. It's incredibly common as we age, and it's one of the leading causes of vision loss worldwide.
It's like the lens is getting foggy,
Yeah.
blocking the light from passing through clearly.
That's a great way to put it. And that's why you get those symptoms like blurry vision, faded colors, and trouble seeing at night, especially when driving.
So if you start having those symptoms, it could be a sign of cataracts developing.
It could be. It's important to get checked out by an eye doctor if you notice those changes in your vision.
Makes sense. So how do they treat cataracts?
Well, the traditional way to treat cataracts is with a surgery called phacoemulsification.
Oh boy, another one of those long medical terms.
I know, right? But don't let the name scare you. Basically, what they do is they remove that cloudy natural lens and replace it with a clear artificial lens called an intraocular lens, or IOL.
So it's an out with the old, in with the new kind of thing.
Exactly. And in recent years, lasers have been incorporated into certain parts of this procedure.
Really? How are they using lasers in cataract surgery?
Well, instead of using a surgical blade to make the initial incision in the cornea and to open up the capsule that holds the lens, they can now use a very precise femtosecond laser.
So it's all about minimizing the invasiveness and making the procedure as precise as possible.
That's right. The laser can also help soften and break up the cataract itself, making it easier to remove.
Wow, that's impressive. So I'm guessing laser-assisted cataract surgery has some advantages over the traditional method?
It can, yes. Potential benefits include greater precision, less energy used during the procedure, and potentially a faster visual recovery.
Sounds like a win-win.
It can be, but it's important to remember that laser-assisted cataract surgery isn't necessarily the best choice for every single patient.
So the decision to use a laser or not depends on the individual case.
It does. It's a decision that's made between the patient and their surgeon, taking into account their specific needs and the surgeon's expertise.
Makes sense. All right, next up we have laser glaucoma surgery. Can you give us a quick explanation of what glaucoma is and why it's such a serious eye condition?
Okay, so glaucoma is a group of eye conditions that damage the optic nerve, which, as you'll remember, is that crucial nerve connecting your eye to your brain, allowing you to see.
Yeah, the optic nerve is like the cable transmitting the visual information.
That's a great way to think about it. And with glaucoma, the damage to the optic nerve is usually caused by high pressure inside the eye, which we call intraocular pressure, or IOP.
Oh, I've heard of that. And if that pressure isn't controlled, it can lead to blindness.
Sadly, yes. Glaucoma is one of the leading causes of blindness worldwide.
That's scary, especially since I've heard that glaucoma often doesn't have any noticeable symptoms in its early stages.
That's right. It's often called the silent thief of sight because it can develop gradually without any pain or obvious vision changes at first.
That's why regular eye exams are so important.
Absolutely. Especially as we get older, those regular checkups can catch glaucoma early when treatment is most effective.
So how does laser surgery help manage glaucoma?
Well, the goal of laser surgery for glaucoma is to lower that intraocular pressure, that IOP, and to prevent or at least slow down further damage to the optic nerve.
Okay, so it's all about relieving that pressure. But how do they do that with a laser?
There are a few different types of laser procedures, each with their own way of working. One common one is called trabeculoplasty.
Trabecular what?
Trabeculoplasty, it's a mouthful. But what it does is it targets this spongy tissue in the eye called the trabecular meshwork, which is responsible for draining fluid from the eye and regulating that intraocular pressure.
So they're basically improving the eye's natural drainage system.
Exactly. And they do that by using the laser to create tiny, controlled burns in the trabecular meshwork.
Burns.
Yeah, it sounds scary, but these are very tiny, precise burns that actually help improve the fluid outflow and lower the pressure.
That's incredible. They're using a laser to make tiny burns that actually improve the eye's drainage. Amazing how technology can be used like that.
It is, isn't it? Another type of laser procedure used for glaucoma is called iridotomy. This one involves creating a small hole in the iris, the colored part of the eye.
Why would they create a hole in the iris?
That little hole allows fluid to bypass a blocked drainage pathway. It's particularly helpful for people with something called narrow angles, which is a structural predisposition that increases their risk of developing a type of glaucoma called angle closure glaucoma, which can be very dangerous and cause rapid vision loss.
So it's like a safety valve, creating an alternate route for the fluid to escape.
Exactly. So as you can see, there are different laser procedures for glaucoma, and the choice of which one to use really depends on the type and severity of the glaucoma, as well as the individual patient's needs.
It's really fascinating how they can tailor the treatment to the specific situation. Okay, the material also mentions trabeculectomy as a surgical option for glaucoma. How does that differ from the laser procedures we just talked about?
So trabeculectomy is a bit more invasive than laser surgery. It actually involves creating a new drainage pathway for the fluid to escape the eye.
Oh, wow. They're actually building a new drainage channel. How does that work?
It's a pretty intricate procedure. The surgeon creates a small flap in the sclera, the white part of the eye, and then makes a tiny hole under that flap to allow fluid to flow out.
So it's like intentionally creating a controlled leak to relieve that pressure inside the eye.
You got it. And that fluid then collects in a small reservoir, or bleb, under the conjunctiva, which is that thin membrane covering the white of the eye.
I see. So trabeculectomy is usually reserved for more severe cases where other treatments haven't been successful.
That's right. It's usually considered when laser surgery or medications alone haven't been enough to control the intraocular pressure.
All right, moving on to macular degeneration, the material you sent mentions surgery for this condition as well. But before we talk about the surgical options, can you explain the difference between dry and wet AMD? I always get those two confused.
Of course. So age-related macular degeneration, or AMD, is a leading cause of vision loss in people over 50. It affects the macula, which, remember, is that central part of the retina responsible for your sharpest, most detailed vision.
Yeah, the macula is what allows us to see faces, read, drive, all those essential things.
Exactly. And there are two main types of AMD, dry and wet. Dry AMD is the more common type, and it's less severe. It happens when the macula thins and deteriorates over time, leading to a gradual loss of central vision.
So it's like a slow decline in the macula's function.
That's a good way to think about it. Unfortunately, there's no cure for dry AMD at the moment, but there is some evidence that certain vitamins and minerals can help slow down its progression in some people.
That's good to know. Now, wet AMD is the more serious type, right?
Yes, wet AMD is more aggressive, and it can cause more rapid vision loss. It develops when abnormal blood vessels grow underneath the macula.
So it's not just the macula itself that's the problem, it's these abnormal blood vessels growing in the wrong place.
Right. And these new blood vessels are leaky, so they can cause fluid buildup and bleeding under the macula, which can quickly damage those delicate cells and lead to severe vision loss if it's not treated promptly.
So is surgery the main treatment for wet AMD?
Actually, the primary treatment for wet AMD is not surgery, but those anti-VEGF injections we talked about earlier for diabetic retinopathy.
Oh, right. Those injections that block the growth of those leaky blood vessels.
That's right. They're very effective in treating wet AMD as well.
Amazing how one treatment can be used for multiple conditions.
It is. Now, the material you sent does mention photodynamic therapy, or PDT, as another treatment option for wet AMD. Have you heard of that?
I have, but I don't really know how it works. Can you explain that one?
Sure. So PDT is a two-step procedure. First, they inject a light-sensitive drug called verteporfin into your bloodstream. This drug is attracted to those abnormal blood vessels in the eye. Then they use a special laser to activate the drug, and that activation destroys those targeted vessels.
Oh, wow. So it's a very targeted way to knock out those leaky vessels. What about using lasers directly to treat wet AMD like they do for diabetic retinopathy?
Laser treatment used to be more common for wet AMD, but it's not used as often now. The problem is that it can sometimes damage the surrounding healthy tissue.
Oh, I see.
And it doesn't always provide the long-term benefits that we see with anti-VEGF injections.
It seems like those anti-VEGF injections have really changed the game for treating a lot of these conditions.
They really have. It's remarkable how one type of treatment can have such a big impact on so many different eye conditions.
It's a great example of how medical research is constantly leading to better treatments and better outcomes for patients. So what else is on the list?
Up next, we have entails, or intracorneal ring segments. Ever heard of those?
Entails. Rings in the eye. Sounds a little intimidating.
It's not as scary as it sounds. Entails are actually very tiny crescent-shaped implants made of a clear, biocompatible material, and they're specifically used to treat keratoconus.
Keratoconus. That's the condition where the cornea thins and bulges outward, right?
That's it. It forms a cone-like shape instead of being nice and round, and that causes distorted vision. So instead of using a laser to reshape the cornea, Intacts are implanted into the middle layer of the cornea to physically support and reshape it from within.
So it's like giving the cornea some internal scaffolding to hold its shape.
That's a good way to describe it. And by flattening that cone, it helps to improve the patient's vision.
Makes sense. And I read that one of the great things about intacts is that they can be adjusted or even removed if needed.
That's right. So if the patient's vision changes over time, the intacts can be taken out or they can be replaced with different size segments to optimize the vision correction. It's a very flexible treatment option.
Wow, it's like having built-in customization for your cornea. Okay, moving on, we have eyelid surgery, also known as blepharoplasty. Now, I'm guessing this one has both cosmetic and functional benefits.
You are absolutely right. Blepharoplasty can be done for both aesthetic and functional reasons. Basically, it involves removing excess skin, muscle, and fat from the upper and lower eyelids.
So it's kind of like a mini facelift specifically for the eyes.
Exactly. And cosmetically, it can make a big difference. It can reduce those bags under the eyes, lift up droopy eyelids, and just give the eyes a more youthful, refreshed look. But it's not just about looks.
Right, there's a functional side to it as well.
Definitely. Sometimes drooping eyelids can actually get in the way of your vision, blocking the upper part of your visual field.
Oh, I can see how that would be a problem.
So blepharoplasty can correct that, improving the field of vision and reducing eye strain.
It's fascinating how the form and function of the eyelids are so interconnected. Okay, what's next on the list?
Next up is strabismus surgery, which is also known as eye muscle surgery. Have you heard of this one?
I have. It's the surgery they do to correct crossed eyes, right?
That's right. The medical term for crossed eyes is strabismus. It's a condition where the eyes aren't aligned properly and they point in different directions.
And it's not just a cosmetic issue, right? It can affect how well you see.
Exactly. When the eyes aren't aligned, the brain has trouble merging the images from each eye, which can lead to double vision, or the brain might start ignoring the image from one eye to avoid double vision. But that can lead to problems with depth perception and can even affect the development of normal vision, especially in children.
Wow, so it's really important to address strabismus, especially in kids.
It is, and that's where strabismus surgery comes in. The surgery involves adjusting the muscles that control how the eyes move.
So they're basically tightening or loosening those muscles to get the eyes to point in the right direction.
You got it. The surgeon might strengthen, weaken, or reposition those muscles to try to achieve proper alignment.
That sounds like a very delicate and precise procedure.
It is. It requires a lot of skill and experience to make sure they get it just right. But when it's done successfully, it can really improve both visual function and cosmetic appearance.
Amazing. Okay, now for the last one on the list. Artificial eyes. That sounds pretty self-explanatory, but is there anything we should know about them?
Well, the official term for an artificial eye is an ocular prosthesis. And it's basically a prosthetic eye that's used to replace an eye that's been removed, maybe because of an injury, a disease, or a birth defect.
So it's mostly about restoring a natural appearance after someone has lost an eye.
That's a big part of it, yes. A well-made ocular prosthesis can look very natural and can really help boost a person's self-confidence, but it also has some important functional roles.
Really? Like what?
Well, it helps support the eyelids and the surrounding tissues, preventing them from collapsing inward. And while it doesn't restore vision, it can really improve a person's overall quality of life after losing an eye.
Wow, we've covered so much ground today. Lasers, lenses, eye muscles, artificial eyes. It's incredible how many different types of eye surgeries there are.
It is. And the technology is constantly evolving, leading to safer procedures, faster recovery times, and better outcomes for patients. It's a truly remarkable field.
Wow, we've covered some really fascinating ground in this deep dive. From lasers to lenses to eye muscles, so many different types of eye surgeries out there. But before we wrap things up, the material you sent also touches on the overall patient experience, which is just as important as understanding the procedures themselves.
Absolutely. The patient experience is a huge part of it.
For sure. And the material outlines what you can typically expect, starting with that pre-surgery phase.
Yeah, the pre-surgery phase is really where it all begins. And it starts with a very thorough eye exam.
More than just checking your vision, right?
Oh, much more. It's about getting a really comprehensive picture of your overall eye health.
So they're looking at the whole eye, not just the specific problem you're there for.
Exactly. They'll measure things like your corneal thickness, your eye pressure, and a whole bunch of other factors to get a baseline and make sure they have all the information they need.
I see. So it's about making sure you're a good candidate for the procedure and that there aren't any underlying issues that could complicate things.
Exactly. It's also a time to have a really good conversation with your eye doctor. They'll explain everything in detail, answer any questions you have.
So you're not going into it blind, so to speak.
Exactly. They'll walk you through how the surgery works, what the potential risks and benefits are, what you can expect before, during, and after the procedure.
So it's all about clear communication and making sure you feel comfortable and informed every step of the way.
Absolutely. And speaking of during the surgery, the material you sent mentions that most eye surgeries are now done on an outpatient basis.
Outpatient, meaning you go home the same day.
Yep. No need to stay overnight in the hospital for most of these procedures.
That's pretty amazing. And I also read that they usually just use numbing eye drops, so there's no actual pain during the surgery itself.
That's right. They numb the eye really well, so you won't feel any pain. You might feel some pressure or some sensations, but not pain.
That's a relief. Now, I know they use different levels of sedation for different procedures, right?
Yes, they do. For some procedures, you might just have what's called monitored sedation, which is where you're awake but relaxed. It's kind of like a twilight sleep.
Okay, so you're aware of what's going on, but you're not really feeling anything.
Exactly. But for more complex surgeries, they might use general anesthesia, which means you'll be completely asleep during the procedure.
Got it. So the level of sedation really depends on the type of surgery and the individual patient, I guess.
Right. It's something you'll discuss with your doctor beforehand.
Okay, so let's talk about the recovery period. What's the typical experience like after you've had eye surgery?
Well, recovery time can really vary depending on the type of procedure you had. But some common things people might experience are a bit of blurry vision for a while.
That makes sense.
Yeah, your eyes need time to heal and adjust. You might also have some dry eyes, some sensitivity to light, maybe some mild discomfort. But these are usually temporary and should improve within a few days or weeks.
Okay, so nothing too serious, usually.
Right. But it's super important to follow your doctor's instructions carefully.
Like wearing those funky sunglasses they give you?
Those are important. They help protect your eyes while they're healing, and your doctor will also give you specific instructions about how to use any prescribed eye drops, what activities you should avoid, and when you can start getting back to your normal routine.
So basically, listen to your doctor, be patient, and don't overdo it.
Exactly. And keep all of your follow-up appointments so your doctor can check on your progress and make sure everything is healing well.
Good advice. Wow, we've really explored an incredible world of possibilities in this deep dive. From simple vision correction to complex surgeries for eye diseases, it's amazing how many options there are now for improving vision and maintaining eye health.
It's true. And it's all thanks to those brilliant minds out there who are constantly pushing the boundaries of medical technology and coming up with new and better ways to treat eye conditions.
Absolutely. I think it's safe to say that the future of eye care is looking very bright.
I couldn't agree more, and I think that's a perfect note to wrap things up on.
Well said. Thanks for joining us on this fascinating journey into the world of eye surgery. It's been a real eye-opener, so to speak.